Hello and welcome to the program today. I'm your host here on Health Professional Radio. Thank you for joining us. Our guest in studio is Dr. Michael Feld, Child and Adolescent Psychiatrist, and he's here in studio to discuss with us how to explain to parents that ADHD is a treatable neurobehavioral condition. Welcome to Health Professional Radio, Dr. Feld.
Thank you.
Now, we hear about ADHD, ADD, children in school having problems, adults not being able to hold a job. What exactly is ADHD? And maybe we can clear up some of the misconceptions about it.
Okay, well, that's a great question to ask. ADHD is a very common neurobiologic disorder. What ADHD involves is a constellation of symptoms that include a high level of inattention and distractibility, with or without a lot of overactivity and impulsivity. And these symptoms aren't accounted for due to other reasons. They're just basically due to the neurobiologic issues that drive them in the prefrontal cortex. These symptoms, to meet the criteria for ADHD, have to cause impairment in people's functioning, children, adolescents and adults. So if you see symptoms that interfere that are along those lines, we look at the possibility of diagnosing ADHD.
Are the symptoms of ADHD and ADD interchangeable, or is there a stark difference between the two, or is it a simple, small behavior that separates them?
Oh, well, actually, with the current psychiatric nomenclature, everything would be called ADHD.
Oh, okay.
There are actually three presentations or subtypes of ADHD.
Okay.
There is a combined subtype, which would include inattention, distractibility with significant impulsivity and hyperactivity. And then there is an inattentive distractible only subtype, and the least common is a hyperactive impulsive subtype. So you can see ADHD present in three different ways, but children and adults, obviously experience a persistent pattern of these symptoms that is severe enough to interfere in more than one area of functioning: home, work, school, social, and other areas of life.
Are there symptoms that mirror ADHD? And if so, how often is this misdiagnosed? And how much of a problem is that for someone who's trying to maintain a life under a misdiagnosis?
Obviously, there are other reasons that people would have difficulty with inattention, difficulty with distractibility, possibly impulsivity and overactivity. So that the key is to obviously have a clinician that's able to tease apart what is ADHD versus how these symptoms could present. Someone that has difficulty sleeping, or depression, or anxiety, or even a thyroid issue or blood sugar issues. There's reasons that you can see these symptoms. What separates out ADHD is that there's really a persistent pattern of these symptoms that begin early in childhood and can persist throughout life that interfere with functioning and aren't accountable due to these other reasons.
So how invasive is a diagnosis of ADHD? Is it at all invasive? How exactly is it diagnosed, and how can you reduce misdiagnosis?
That's a great question. Well, one, let me give you the idea that ADHD is it's as we're talking about it, we know it's a treatable medical condition, but it's thought that the most recent data shows that approximately 4.4% of adults in America, or 10 million adults, and approximately 11% of children aged 6 to 17, which is approximately 6 million children, at some point meet the criteria for a diagnosis of ADHD. So the way to diagnose ADHD is obviously bringing together multiple areas of information. But ADHD is truly a clinical diagnosis, but a clinician trained or capable of diagnosing ADHD would not only use interviews. If it's a child, they would use interviews with the child and with their parents, but then they would also put together data from let's say school report cards, teacher reports, the use of rating scales, psychiatric rating scales that we use, maybe the result of a neuropsychological evaluation, maybe the results of some computerized tests that can help indicate whether somebody may have ADHD. So the trick to diagnosing ADHD is looking at symptoms throughout, looking at reasonable presentation of ADHD from multiple sources, and then ruling out other causes. And then, obviously, if you're skilled enough, you would obviously hopefully be more accurate in diagnosing ADHD. I'm sure there are, clinicians that struggle with accurate diagnoses, but the key to diagnosing ADHD or to having a proper diagnosis would be to find a clinician that's, capable and very secure and experienced in diagnosing ADHD.
You being an expert in adolescent, child, and adult diagnosis, do symptoms present in different ways as a person, say, actually they have ADHD, they've not been diagnosed as a child, nor as an adolescent? Are these symptoms that present themselves in a recognizable pattern, does that pattern change distinctively as they progress in age, or does it stay the same? Is it the same test, the same methodology to diagnose regardless? Are we just looking for the disease itself, or how much personality is involved in the diagnosis?
Personality of the person diagnosing or the patient?
Well, both. You talk about a high level of skill and confidence being involved on the clinician's part, and I'm sure that a person who has ADHD is going to have some personality traits that need to be addressed in conjunction with the diagnosis itself.
Right. No, absolutely. So to answer your question, the symptoms of ADHD often do change as you age and go throughout life. So obviously a clinician has to look for that impulsivity, and an adult might show itself a little less as you age. You might not, a young child might run onto the street without looking both ways to chase a ball, and an adult might not be as impulsive, but they might show the impulsivity in different manners, or it might be a little more emotionally impulsive. So the trick for diagnosing ADHD in adults is looking for early signs and symptoms, how they presented as kids, but also recognizing how inattention, distractibility, and impulsivity and overactivity is manifesting itself in the adult. But you do have to recognize that the same symptoms that you might look for in a kid are not going to show themselves always exactly the same as an adult. And it's thought that the hyperactivity and the impulsivity often change more as you get older and often improve. But the inattention and distractibility often continues, but would look differently in an adult in a job setting than in a classroom setting.
Wow. I was wondering how much difference there is when you tell a parent what they should be looking for and a teacher what they should be looking for. How much of a difference? I mean, one is your child, you're their caregiver, their guardian. The other, it's your job to teach the child and protect the child while they're at school only. When it comes to looking for symptoms, how much of a difference in what you would explain to a parent as opposed to a teacher when it comes to children?
Right. Well, what you would do is you would obviously explain the same type of symptoms you're looking for, but the teacher's seeing the child in a structured school setting. So you're going to instruct the teacher what to look for in a classroom setting, whether it's inattention or distractibility or impulsivity. You're also going to have them look for how the child interacts socially and at recess and in other areas, but they're only going to see the child in the school setting. They're also going to obviously give reports about whether the child's getting his homework in, how organized they are, how productive they are with school, what they see on test taking, and just other classroom behavior. With a parent, you're going to not only obviously instruct them to look at the same symptoms, but you're going to be instructing the parent to look at all areas of the child's life, and including school, including social relationships, and even religion, going to church, going to temple, what it's like for them in athletics, what's it like for them getting along at night and the family. So with parents, you're really broadening the areas of life that they have to see how the ADHD is interfering. And with the teacher, you're really honing them into how it's impacting school functioning and behavior.
Where can we go to learn more about ADHD on the internet?
Well, I mean, I think there's multiple settings. The key to reading about ADHD is to look at a solid medical website, or to look at areas on the internet where the thinkers and the professionals and the experts in ADHD are putting data on. It's also important to recognize that you could go to the pharmaceutical companies' websites and read about the research, and it's obviously fair and balanced, and you can look at the information and data on the medication there also.
Well, it's been a pleasure talking with you this afternoon, Dr. Feld, and I thank you for joining us here on Health Professional Radio.
Thank you.
I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.